Smartphone app has been released to support Aboriginal and Torres Strait Islander women during their pregnancies. The developers hope it'll transform maternity care across the top end. And joining us now is the Menzies Maternal Health Program lead and OBGYN herself, Associate Professor Kiana Brown. Thanks for joining us.
My absolute pleasure. Thanks for having me today.
How did this app come about?
Well, it came from just listening to the community. So our team at Menzies had been tasked with this little job to try and improve perinatal outcomes in pregnancy and birth and for babies up here in the top end. And particularly we wanted to focus on safely reducing preterm or premature births. And so what we did was we first listened to women who'd had that experience in the past. And what we learned from them was so rich. What they told us was that when they had these challenging pregnancy outcomes, it just came from nowhere. They were completely unprepared. It was completely unexpected, and it still affected them years and years later. And so we talked to them about what might help, and they said we just need consistent information that's for us, that we can identify with, that brings in our cultural knowledge, and it's relevant to where we live and where we work. And basically that's how it came about.
So tell us about some of the features, how this app will work for these women.
Yeah, so when we brought together our co-design workshops from around the top end, women said, yeah, I like reading stuff, but I get a bit bored of that. What I actually want to do is I want to watch stuff and I want to listen to stuff. So one of the most exciting parts of this app is that we've been recording all these podcasts with actually maternity care providers, health professionals, as well as women from across the top end. Because what they identified to us, what was really important, was that they wanted to hear from women with lived experience. They wanted to hear from women just like them who'd gone through these things and could provide that real life evidence. You know, midwives and doctors, we talk about things in certain ways, but when you're learning from peers, it's even more meaningful. And when we were recording these podcasts, the women were so generous in providing all this personal information about what they'd been through so that they could really help prepare other women emotionally, mentally and physically for what might come for them.
You mentioned that there are some challenges, preterm could be one of them. What are some of the challenges that women experience in the top end?
Well, the biggest challenge is just having access to maternity care in the way that they want to receive that care. So we have limits in our choices about where we have care, how we receive that care and who provides it for us. And particularly for women in remote communities, you know, the access to resources and what they have available is really challenging at times. Sometimes there's a midwife in the community and sometimes they're not. And sometimes those midwives in the communities are really, really busy. So sometimes all the pregnancy information and education that we might take for granted is not available to them. The great thing about this app is that we've also partnered with women from remote communities. So the Wangatunga Strong Women's group from the Tiwi Islands found us when we were promoting some of our work, and they said, this is really important for our women and we want to be involved in that as well. And so now we're developing podcasts and educational video resources that have been recorded in Tiwi Aboriginal language, which is so exciting for those women.
Do you think this could lead the way for other app development in other health areas or for other pregnancy apps too?
Yeah, that's certainly the dream, that we will apply the process and the methods that we've done to develop this app that's been co-designed with our community, that's the content and the look and the feel of the app has been driven by what the community actually want and need. And we will apply those same principles and make it broader, not only across the top end in, you know, different languages and for different population groups, but across the Northern Territory more broadly and hopefully even reach wider parts of the country.
Oh, it is fascinating. Associate Professor Kiana Brown, thanks for your time.
My pleasure. Thanks so much.